Welcome to the Observe Day podcast, the show where we celebrate the days that matter. From holidays to meaningful observances, we bring you inspiring conversations, stories, and ideas to make each day count. Whether it's raising awareness, learning something new, or simply sparking joy, this is your space to explore the calendar in a whole new way. I'm your host, Wisdom Okonkwo, and I'm excited to share today's observance with you. Let's dive in. September is National Childhood Obesity Awareness Month, a time to shed light on one of the most pressing health challenges facing families today. Childhood obesity is often misunderstood as a matter of willpower, diet, or exercise, when in reality, it is a complex disease influenced by genetics, environment, and biology. Today on the Observe Day podcast, we're joined by Dr. Nadler, one of the nation's leading pediatric bariatric surgeons and a true pioneer in childhood obesity treatment. For over 2 decades, he has helped children and families navigate this disease while also contributing groundbreaking research into fat cell biology and weight regulation. With his vision to transform the lives of 100 million people battling obesity, Dr. Nadler is here to help us understand the science, the stigma, and the solutions. Welcome to the podcast.
Oh, thank you so much for having me. It's a
Yeah.
pleasure to be here, and I'm really, excited that you're taking the opportunity to celebrate Childhood Obesity Awareness Month.
Yeah. Why is it important to have a dedicated month like National Childhood Obesity Awareness Month?
It's a good question because for me, every day and every month is Childhood Obesity Awareness. That's my mission. That's all I do. It's what I talk about all the time. But I think it is important to have a dedicated month because it really sheds additional light on the importance of this disease. And as you mentioned in the intro, there's so many misconceptions about why children suffer from obesity and how it's passed on from generation to generation. And there's so much patient or self-blame and self-shame for people with obesity, and then parental shame and blame if they have a child who's suffering from obesity. So it's really my mission to try to help those people understand that it's not their fault. It's a disease like any other disease. And the science behind it explains it. And thus, that's what I'm trying to do, is explain that science so people get a better understanding.
Yeah. Oh, thank you. One of the misconceptions or the way people approach obesity once they hear the word is they see obesity as a lifestyle choice. How do you reframe it as a disease and why?
Yeah, so that's like one of my taglines is obesity is a disease, not a lifestyle choice. And I think sometimes it's easier to understand that when you frame it around children. So
Okay.
let's say I see an 8-year-old who has type 2 diabetes already from their weight. I would argue, and because I've seen it a million times, that child did not eat their way into that disease, nor did they lack of exercise their way into that disease. In fact, they eat the same as their peers and exercise the same as their peers. So the external environment, what they're eating, how much they're playing, is a very small factor, if a factor at all. What's much more important is actually their parents' health when the child was conceived, or the mom's health during her pregnancy, or, does obesity run in the families, and what genes are passed down from generation to generation. So it really, kids often haven't even been on the earth long enough for the external environment to have a significant impact. And so that's sort of how I try to reframe it. Not to mention, who would make the lifestyle choice to have obesity, especially as a child? Like, growing up is hard enough, and adolescence is hard enough. Why would you ever think about making it harder on yourself by, having a disease that everybody can see, from across the room? So yeah, it's not a lifestyle choice. Believe me, that's not even a consideration when it comes to children.
Yeah. I'm curious, what makes childhood obesity different from obesity that develops in adulthood?
Yeah, so that's more along the lines of what I was already just talking about, which is so one of my other, taglines or concepts that I try to get across to people is that obesity is what we call a phenotype, meaning how something looks on the outside. So obesity on the outside pretty much looks the same, no matter whether you're an adult or a kid. whatever your ethnicity or race is, whatever your sex is, it sort of looks the same, and people think they know what it looks like. But it comes from a bunch of different, what we call genotypes, which really means different pathways for how it got there. So, some people get obesity because they have mental health issues. Some people get obesity because they inherited it from their parents. Some people get obesity from, food addiction or other outside influences. And then some people get it actually from cancer or tumors of their brain that get irradiated or removed. So it comes from a bunch of different pathways, and those different pathways really should be taken into consideration when you're talking about how to treat it. And so what makes childhood obesity different is that, again, the external environment plays less of a role. So it's almost a purer form of the disease, more of a genetic disease. But also, and a lot of people don't know this, obesity, the diseases related to obesity in children progress faster than they do in adults. So if you have insulin resistance, let's say, or prediabetes as a kid, or the time between when that turns into frank diabetes is shorter if you're a kid than if you're an adult. So that's what really makes childhood obesity, in my mind, even more urgent to treat, because it progresses faster. And also because we know that diet and exercise don't work for childhood obesity. They don't really work for any obesity, but they certainly don't work for childhood obesity. So the old myths of like, they'll grow out of it, or it's just baby fat or whatever, like those have to be, we've got to get rid of those sort of stereotypes or old time views of how weight in children is important or not.
Yeah. While you were explaining, you mentioned genetics, and well, how do genetics and the utero environment play a role in a child's future risk of obesity?
Yeah. So there are a couple different ways. So there's a concept that's known as the intergenerational transmission of obesity, which means how does it go from parents to child, or from generation to generation? And one way is genetics. If you have what we call sort of obesogenic genes, or genes that make you prone to having obesity, that's part of it. But then there's a field called epigenetics, which is the sort of a newer field, and that field is how the environment actually modify your genes. So change how they're expressed, change how they're turned into proteins. And that's how we think things like ultra processed foods do some of their harm. And those genes, once they're modified, can actually get passed from mom to child or dad to child as well. And then the in utero environment is extremely important, because we know that children who are born to mothers who either develop diabetes while they're pregnant or have diabetes before they're pregnant, their risk of having obesity and diabetes is, much higher than the average child. In fact, there's even a study recently, which is not about obesity, but it just shows you how important the in utero environment can be, which showed that if a child was born to a mom who had diabetes during her pregnancy or before her pregnancy, they had a 20% higher risk of having autism spectrum disorder. So the in utero environment is way more important in the baby's health than I think we really understood until recently.
Oh,
yeah, it's sort of mind blowing, actually. And so people ask me, what's the best path forward? Like, how do we help change the trajectory of childhood obesity? And I'd say it's kind of twofold. It's one, we have to treat the children who have obesity today so that they don't go on to be adults with obesity and have all the diseases that go with it. But then two, we need to educate the adults who are going to be having kids or who have had kids, and how their health impacts the health of their children. And I don't think we spend enough time sort of talking about that, and how, if you're married and you're thinking of having a baby, how you can optimize your own health before you have a baby so that your baby has the best chance of a healthy and happy life as well.
Yeah. I think what you just suggested now is the idea of unpacking the idea of intergenerational transmission of obesity. Before we dive deeper, I'd love to invite you to join the Observe Day newsletter. Every week, I send you highlights of upcoming observances, creative ways to celebrate, and behind the scenes extras from the shows. It's the perfect way to stay inspired and never miss a meaningful moment. Sign up today at observeday.com/join. That is observeday.com/join. Now let's get back to the conversation.
Yeah, no, I think so. Food policy changes that people are talking about are certainly helpful. And certainly we need to exercise more as a society, and making exercise more available and more accessible and easier is also important. But we can't forget about not only it's Childhood Obesity Month, so the 15 million children in the United States who have obesity, or the 140 million adults in the United States who have obesity, where the dietary
Yeah.
changes, food policy aren't really going to help. So we got to do both. We got to treat the people with the disease now, and then also think about obesity prevention, which is where the whole, food is medicine, or dietary changes or food policy changes. That's where those things can help the most.
Yeah. At the beginning, you mentioned, you said exercise and diet doesn't really work that well for childhood obesity. So I'm curious, what are the most effective treatments available today for children?
Yeah. Diet and exercise can achieve about a 5 to 7% total body weight loss. If you weigh 300 pounds, 5 to 7% is somewhere between 15 and 21 pounds. So that's generally not enough for someone who weighs 300 pounds to be healthier, or to
Yeah.
be fully healthy. It makes them healthier. And again, everybody needs to eat better and exercise more. And it is always part of whatever obesity intervention treatment plan we're talking about. It always includes those modalities. And if you're going to do those, if you're going to, for those to be most effective, they need to be done much earlier in life and at much lower weights. So before kids get severe obesity. But once children have severe obesity, then really you're talking about the same medications and the same surgery that adults get, which again, people have a hard time wrapping their head around that. But I can tell you, as someone who's done more bariatric surgery on children than anyone in the country, it changes lives. It makes these kids healthier, happier. They're able to do things that they weren't able to do previously in terms of sports and in terms of other socializing things that we all think of as sort of normal childhood development or experiences. A lot of these kids couldn't do it. And then when they finally got an effective weight management intervention, they were able to really re-enter their social circles and become a full participant, when oftentimes they weren't before that. So that's actually what gets me the most satisfaction, is when I see kids who, were sort of quiet, shy kids, and then they have surgery and start to lose weight and feel better about themselves, and they come out of their shell, and they have a personality, and they become they become the kid that they were always meant to be.
Yeah.
It was almost like that obesity was holding them back.
Yeah.
Yeah. So that makes,
The
again, that's what
reason,
makes me, I was just going to say, that's
yeah,
what makes me that.
yeah. Well, there's an ongoing debate about how uh, obesity is defined and diagnosed, right? Uh, what's your perspective on that?
Yeah. So that's actually an interesting discussion, because especially right now, there's a lot of discussion about how do we best define obesity. Is it like right now we just use a body mass index, which is a ratio of your weight to your height, which is really just a screening tool and not particularly great at diagnosing the disease. But that's what we started with, and that's what we use as a screening tool. But for me, I try to simplify it in that if your weight is impacting your life negatively, whether it be
Hmm.
a physical comorbidity like diabetes or hypertension, or orthopedic issues or whatever, or even if it's just
Yeah.
affecting you psychosocially, whether it's causing you mental health problems, or it's part of your mental health issues,
Yeah.
or it's it's hurting you one way or another. To me, that's when the weight management needs to be initiated or really aggressively pursued. And I sometimes make a joke that obesity, the name obesity, could be changed to weight gain spectrum disorder, because you
Mm,
know excess weight in any different individual affects them differently. And especially if you talk
yeah,
about sort of around the world, or people of different descents, Southeast Asians, they can't tolerate BMIs that Caucasians in the United States can tolerate. So they need their own uh, diagnosis of diagnostic criteria for obesity. And it varies among the different ethnicities and races, and even amongst people, like even, people who may look the same on the outside, their obesity might affect them completely differently on the inside. So I just try to make it sort of, the number itself isn't that important, although that's what like insurance companies use and the medical textbooks use. But really, it's about if your weight is negatively impacting your health, to me, that's when you sort of have the disease.
yeah. One of the things obesity has is there's a lot of stigma, and I feel like uh, that's making it harder for families. So what role does stigma around the whole idea of obesity play in making the treatment harder for families and people involved?
Yeah, it's 100%. So the stigma comes from multiple different angles, right? So there's the societal stigma of people with obesity and the fact that there are many people who still think it's a lifestyle choice and not a disease. Then there's even stigma inside the families, right? So let's say I've taken care of families where 3 of the 4 children are normal weight and the fourth child has obesity, and they all eat the same stuff and exercise the
Yeah,
same, but the family doesn't understand it. So they try to make the one kid do more exercise or eat differently or whatever. And so there ends up with all this blame and shame, both self blame and shame, but also um, amongst the different family members. And then even providers, right? People come to my office and they often actually break down and cry because I'm the first person who has spoken to them about their disease with like no judgment, where I really from the get-go start with, I don't really want to talk so much about how you got here because I can't change any of that, but let's talk about how we
yeah,
can move forward. What can we do next? Don't forget about how you got here, and we'll talk about that when the time comes, but really let's focus on how we can help you, how you can get better, and let's try to work on you not beating yourself up or your parents beating themselves up because of your health. Let's just get all that out of the room, out of the way, and let's just focus on, getting better. And that's all we focus on.
yeah.
And usually I tell like some bad
Oh,
jokes
thank
or
you.
some bad dad jokes or something to try to break the ice, or I'll, depending on the family, I try to read the room and make sure I don't say something that they won't like, but I'll make, I make
Yeah.
I say a lot of things that probably the lawyers in the hospital wouldn't want me to say, but what are you going to do?
Uh, for parents who are consigned, I'd like to put in two categories. For parents who are yet to give birth to a child with obesity, right? But they're like, okay, since this thing is genetic, all right, that's one category. Because I want you to advise parents, but I want you to advise them in two separate categories, right? Parents who are yet to have a obese child, right? But they're consigned, right? And then also parents who have a child, like they have 3 kids, and then one is just different, even though they eat the same food. What advice would you have for those each of those parents? What first some of the first steps they can take?
Yeah, for sure. So if you're a parent who, let's say, had obesity yourself or runs in your family, and you're concerned that your young child um, might develop it but hasn't yet, so that's a really good time to focus on the lifestyle changes and the behavior changes, and like try to set a good example for that child, and try to develop healthy habits as a family. And it's really tough when, so in your second example, where one child is an outlier, it's really tough to get the whole family to commit to being healthier. but that's when it works the best. It works the best when everybody's on board together. And even if the other kids don't need to eat as healthy from a weight standpoint, eating healthy will still benefit them. And you just have to sort of convince them that if they're going to have foods that the one child shouldn't have, they just need to do that, outside of the house, or like, doesn't matter if everybody likes Coke in the house, the Coke has to leave the house because the one kid really shouldn't drink that.
Yeah.
So that's what I would say for the people who are concerned. That's what I would say to start with, is just really trying to develop good habits, model good habits, and talk about it with your kid, depending on the age, and tell them why you're concerned, and why you're asking them to do things that they may not really understand or want to do. And I have to say that, like, a lot of my first patients, when I first started doing this 20 years ago, were actually kids of parents who had had bariatric surgery themselves, because they didn't want their kids to have to go through what they did. So, explain that to them. Tell them that, you as a parent had issues with your weight and still do, or whatever, and you just don't want your kid to have the same sort of health issues. Now, for the second
Yeah.
group,
Oh,
where you already have a child who has obesity. So one of the big problems in this country is that pediatric weight management programs are not everywhere geographically, and they are even in places like where mine was in DC. We had so many patients that we had, hundreds of patients on the waiting list because so many people need the care. So it's actually why I've started a telemedicine practice to try to help kids who can't drive 2 hours because they live 2 hours from the nearest medical center that has a program, or the family can't afford to miss work, or the kid can't afford to miss school. That's one sort of solution that colleagues of mine and I have sort of been talking about. And like I said, we've started a practice doing that. But I guess what I would tell that family is, don't ignore the problem. Start with your primary care provider and talk about the problem and normalize it. Like, don't make it a huge issue, but just say, listen, um, your weight is potentially going to lead to, or may have already led to, health issues, and let's go talk to some people about what maybe we can do about it.
yeah.
And then hopefully the primary care provider, if they don't have experience or comfort in dealing with it themselves, they'll refer to a specialty group that can. But unfortunately, I had plenty of kids who just found me on the internet, and then because their pediatrician or whatever didn't know how to help. And then the kid would actually have to go to their parents and convince their parents to let them come see me or to make an appointment.
Yeah.
Unfortunately, it does sometimes entail some some work on the internet, finding people, or trying to find the nearest center, or just trying to get care.
Yeah.
And actually, there are medications and surgery that work for childhood obesity. And we now have, like I said, I've been doing it for 20 years, and there are good studies with 15-year follow-up of surgery that show that the health benefits remain. And we're learning more about the medications as they're coming out. But I think they'll all have a place, they'll all have a role to play in childhood obesity management as we move forward.
Oh, well, thank you so much, Dr. Ivan. Uh, it's been an absolute delight. I know better about I feel like I'm enlightened on the idea of the childhood obesity. There's so many things I never really knew or understood. Thank you so much for clarifying that, and for making us understand it better. Thank you so much, Dr. Ivan.
Yeah, my pleasure. And in general, people should just, have empathy, and treat each other kindly, and stop sort of judging others, and just understand that, again, obesity is a disease and not a lifestyle choice. And, there is something you can do about it. So thanks for
Yeah,
having me, and I'm happy to come back
yeah,
anytime.
yeah, my pleasure. You're welcome. Where can listeners learn more about the work you do and also connect with you?
So my website is an easy place, and that's, it's www and then Obesity Explained. So Obesity Explained is kind of my, I guess, brand, for lack of a better word.
Yeah.
So obesityexplained.com. And then my YouTube channel is also Obesity Explained. And both those places have lots of free educational videos for people to watch. You know, I go obviously into more detail regarding some of these topics that we just touched upon. So if you want to watch, like 5 minutes of a more in-depth deep dive into the genetics, let's say, that's on there. And then people can always email me if they want, and that's my first name dot my last name at my initials, which are EPNMD.com.
Well, thank you so much. I'll be sure to add the links in the description and the show notes so listeners can just click and go directly to the site. It's been a pleasure chatting with you, Dr. Ivan.
Yes, thank you again. And like I said, I truly am happy to come back anytime. I could talk about this all day.
Yeah. I've stopped. That's it for today's episode of the Observe Day podcast. Thank you for spending your time with us as we explore today's observance. If you enjoyed this episode, be sure to subscribe wherever you listen to podcasts and share it with a friend who'd love to celebrate life's special days too. Don't forget to join the newsletter at observeday.com/join for more observance stories, tips, and updates. Until next time, keep finding meaning in every day.